Those who have been diagnosed with diabetes will be familiar with how it feels to have high blood sugar. But for the millions of people walking around with diabetes or prediabetes and unaware of it, knowing the signs of high blood sugar could prompt them to seek care and get a diagnosis as soon as possible. Early on, high blood sugar can make you feel off in a variety of ways. 1. Fatigue. Feeling tired may be the most common early sign of high blood sugar. It's also one that can occur, to a mild degree, with even the mild and normal blood sugar fluctuations that occur in people without diabetes, or with prediabetes, when they consume a large amount of simple carbs, like sugar. Of course, tiredness is a pretty nonspecific symptom, and can even be a sign of low blood sugar. If you notice fatigue regularly occurring right after you eat, especially a carb-heavy meal, it may have to do with rising blood sugar levels. 2. Frequent urination. When you have too much sugar in your blood, your kidneys start trying to pour out more sugar to get rid of it. And as they excrete the sugar, they pull out water with it. This makes you have to visit the restroom more than usual. 3. Increased thirst. This is a natural effect of urinating more, because your body becomes dehydrated. You start feeling thirsty all the time. The dehydration also becomes cyclical. The more you urinate, the thirstier you are. The more you drink, the more you urinate, and so on. 4. Headaches. Dehydration from any cause can trigger headaches. Of course, headaches can be a sign of many different things, but it's worth getting checked out if it's something new or coupled with other symptoms. 5. Blurred vision. When there is excess sugar in the blood, it can affect some unexpected areas in the body, like your eyes. Essentially, extra sugar, along with a little water, gets trapped in the lens in the middle of the eye, causing a blurred effect. This is temporary, and not the same as the damage to the eye that can occur in the long term. 6. Nausea, vomiting, confusion, and more. These seemingly disparate symptoms are all signs of a rare and potentially life-threatening state called diabetic ketoacidosis (DKA). DKA can cause these symptoms, as well as stomach pain, trouble breathing, dry or flushed skin, fruity-smelling breath, or difficulty paying attention. It usually occurs in people with type 1 diabetes and is sometimes the first sign they are sick. More rarely, DKA can occur to a milder degree in those with type 2 diabetes. Unable to use the sugar in the blood for energy without insulin, the liver begins to break down body fat into a type of fuel called ketones at such a high rate that they become toxic and make the blood acidic. DKA can be fatal if left untreated, so anyone experiencing these symptoms should seek care immediately. Over time, untreated high blood sugar can cause additional symptoms. 7. Recurrent infections. Consistently elevated blood sugar levels can weaken the body's immune response. This makes it harder for your body to fight off some infections, making them more frequent, lingering, or serious. Frequent yeast infections are common in women with diabetes. This is because excess sugar from high blood sugar spilling out through the urine helps feed the bacteria that can cause these infections. Women with diabetes are also more prone to UTIs. 8. Slow healing sores. High blood sugar levels can affect your body's circulatory system as well, impairing blood flow and the body's ability to heal itself. Sores that take a while to heal, often on the feet, are a common sign of this decreased circulation. 9. Dental issues. Glucose is present in your saliva as well as your blood. When there's too much of it, it helps harmful bacteria in your mouth grow and combine with food particles to create plaque. This leads to issues like tooth decay, cavities, gingivitis, gum disease, and bad breath. 10. Tingling hands and feet. Over the years, having too much glucose in the blood can begin to impact nerve function and eventually cause nerve damage, called neuropathy. The most common kind of neuropathy is peripheral, which affects the extremities. You might start noticing feelings of tingling, numbness, or burning in your hands, feet, arms, and legs. What to do if you have these symptoms? If you are experiencing these symptoms, a trip to a primary care provider is usually enough to tell you whether high blood sugar due to diabetes or prediabetes is the cause. If your doctor suspects you might have diabetes, they may do a fingerstick test on the spot to see your current blood sugar and/or a blood test to see your average blood sugar over the past few months. Your physician may also test for certain autoantibodies to determine whether your diabetes is type 1, the autoimmune version of the disease. High blood sugar treatment and prevention. How you treat and prevent high blood sugar depends on the cause and the individual. But it will almost certainly involve working with your healthcare team on a plan involving a mix of lifestyle habits and medications to help you best manage your condition. If the test results indicate you have prediabetes, there are things you can do that may help mitigate or even reverse prediabetes and prevent type 2 diabetes, including losing weight if you are overweight, exercising, changing your diet, and taking prescribed medication. If you are diagnosed with type 1 diabetes, you will need to test your blood sugar often, with finger sticks and potentially a continuous glucose monitoring system, take insulin every day, via injections or an insulin pump, when you eat carbs or have high blood sugar, and exercise regularly, according. If you are diagnosed with type 2 diabetes, you will also have to monitor your blood sugar, make certain lifestyle changes, like eating a healthy diet and exercising, and potentially take medication, such as metformin and possibly insulin. In both type 1 and 2 diabetes, the best way to prevent high blood sugar is to follow your treatment plan and talk to your doctor if something is not working for you. Thank you for watching. Please don't forget to like, comment, and subscribe.